Welcome to Geological Shop Talk. In this podcast, we bring you roughly 20 to 25 minutes of practical clinical methods, perspectives, and advice that has its work boots on. Listen in for clinical gems that you can begin to investigate the next time that you walk into clinic. Additionally, visit the show notes page for supporting materials from this week's guest on Shop Talk. All right, friends, roll up your sleeves. Let's get to work. This episode of Shop Talk is brought to you by LASA OMS, your clinic's partner in wellness. Later in the show, listen for a special offer from LASA to help you with all the transitions your patients face. The information shared on this podcast is for educational purposes only and is not intended as medical advice. Always consult a qualified licensed healthcare professional before making any decisions about your health or treatment. The host and guests are not responsible for any actions taken based on the content of this podcast. Hey friends, welcome to our new Shop Talk series. It's kind of a rebooted series. We did this previously. We're coming back to it because the podcast is great for a wandering conversation, but the Shop Talk is wonderful for digging in on something specific, something that we can teach in a short amount of time that you can take and start using in your clinic right away. I am delighted today to have Carly Herrero with me. Carly is really keen on Gua Sha. I got to admit, I hate to say this, but when I was in acupuncture school, they taught us Gua Sha, but I didn't learn it because, I thought it was just like folk medicine that wasn't that important. I was there to be an acupuncturist, and years later, I found out how wrong I was. So I feel like I'm doing a little bit of penance here. It's time to really promote Gua Sha. And Carly's here. She's from Maine. She's an acupuncturist there and a massage therapist. She teaches Gua Sha. She does Gua Sha. And today we're here to talk about Gua Sha for colds, flus, and coughs, something that you might be dealing with here in the next few months. Carly, welcome to the Geological Shop Talk.
Thank you so much. It's a pleasure to be here.
So Gua Sha, tell us a little bit about how you use it for colds, flus, and coughs, and tell us a little bit about how you got so keen on this particular method.
Sure. Well, the backstory with using it is I started using it as a massage therapist. And so it was pretty much musculoskeletal pain. And I just had so much time with the client, with the patient. And I just saw what a game changer the Gua Sha was. And so I really learned kind of in the trenches of just doing it. And then eventually went to acupuncture school and learned about it from the Chinese medicine. And I read some books about it. Started teaching. That also started really organically just to spread the word. And now now I offer workshops and online classes. So yeah, I mean, I really have just seen like what an extraordinary change it can make for people with the change in the tissues, change in the body, change in how they feel. So I'm happy to be able to talk about it. And I hope we can, get people inspired to use it in their clinic.
Absolutely. That's the whole idea here. Now, again, we're focusing on colds and flus,
Yes.
coughs, that, very emergent stuff, really. How does Gua Sha help with this? And I'd like to hear both your perspective as an acupuncturist and as a massage therapist, kind of, body worker kind of person. What's going on here? Sure.
So there's several levels of a healing response that happens with Gua Sha, which it sort of touches back to maybe your first impression of like, oh, it's a folk medicine. It's so simple. It's like really deceptively simple. Like, why would rubbing or scraping the skin generate this? And in a way, it's kind of like acupuncture. We're sort of going back and trying to reverse engineer, from a biomedical perspective to see what's actually going on with this ancient medicine. But yeah, so Gua Sha produces a kind of, I often think of it as a local inflammation that reduces systemic inflammation. And so I'll sometimes describe it, for patients as like a controlled burn in a forest where there's, we are creating inflammation, but studies have been shown. There's an interesting study that did blood tests before and after Gua Sha, well, it's cupping, which has a very similar action as cupping, or as Gua Sha, and it showed reduction in inflammation markers in the blood test before and after just one treatment. So we use a tool that has enough with Gua Sha. We use a tool that has enough of an edge to create a little bit of a friction, and this is kind of key. So it's not just a totally smooth like stone that like glides over the skin. Although we could talk about that from a massage or like cosmetic facial perspectives. But we have this friction, and it triggers a therapeutic response in the form of the body kind of releasing the blood basically to the superficial blood vessels. I've heard one of the authors of Gua Sha book, Arya Nielsen, who does a lot of research, and she calls it extravasation, which extravasation.
That's a fancy
blood,
word.
it's a super fancy word, and it's because we don't have a lot of words in the Western biomedical model for what this is to show that it's not pathological. So we could call it like an eruption of blood to the superficial vessels, or this extravasation or inflammation. But I also think of it as maybe like when we have a fever, which is a natural response to generate some heat, and maybe even a rash might be generated or flushing, and that's a healing response. So all it is to say, this has the capacity to trigger the body's kind of boost the body's ability to throw off pathogens to the surface. That's really the key. Gua Sha allows the body to throw off pathogens to the surface, and it's various systems all working together, again, as we know from Chinese medicine, where we see the confluence of things. So it's vascular, immune, it's the skin, and it's the myofascia. So you can see how all of this would create like an immune cascade that would help with colds and flus and coughs. We'll get a little bit more specific with some of those particular things, but yeah, it just triggers this really interesting response in the body.
This sounds a bit extravagation. It sounds a little bit like release the exterior, right? You're going in, you're causing a little bit of a micro trauma, you're increasing circulation, you're literally bringing yang qi to the surface of the body. What are we doing with acupuncture? And well, herbs in particular, especially if there's cold, you're bringing yang qi up to the surface.
That's right.
So it kind of fits in both from the Western way that you were just explaining about using inflammation, small amount of inflammation, to create a cascade of treating inflammation, controlled burn. I like that. Excuse me. I like that phrasing. But it very much fits in our traditional method as well. So that's pretty cool. Tell us about how you would treat somebody like early stages, right? Maybe they're a little headachy. They're a little like, I might be coming down with something sort of phase.
Yes. So we do want to, as always, we want to assess the patient and see where they're at in their particular constitution. Are we, we're looking at a deficiency, or looking at a general excess, or, obviously people are more complex than that, but what's the general, sort of temperament, constitution, not temperament, but yeah, constitution of the person. And then how is this acute situation, this onset, how is it manifesting in them? Has it gone really deep really quickly? Is it still sort of at the surface? I will say, just full disclosure, especially since COVID, I have found it tough to get people in the clinic with early onset cold and flu. Like it's just, and I try to educate people. So to get people on the table, like at that perfect timing where like you're just starting to feel a little bit off, and is a little bit tricky, but
it's totally challenging because in the Western clinic, they're told not to come in. If you think you're sick, stay the hell out of here.
Yeah, so that's where we have to maybe, do some education about self-care that they could do on their own, and and then maybe moxa at home to help heat
Hmm.
the body. But let's just say, in the textbook or classroom or laboratory, the person can come in. But I do want to make sure that they've got enough yang, they've got enough qi to be able to process all of the reactions that I'm going to be triggering in the body. So we don't want sort of well, it's, you're going to feel way worse for 3 days and you'll feel a little bit better. And, like how much are we speeding things up and stirring things up? So, so caution with that.
Hmm.
But,
So dosage and constitution are important. You can't just go there, Gua Sha, okay, you're good to go. Are they strong? Are they weak? Is it hot? Is it cold? And then how much you do, it sounds like it has to come out of all that. This is basic Chinese medicine thinking. I think our listeners and viewers will understand that. What are some of the key things that you look at in terms of deficiency or excess to help guide how strong the treatment you do, and where do you do that treatment?
yeah, good question. So I'm glad you brought up dosage because that's a really key part of Gua Sha, and I want people to start thinking about Gua Sha just in the same way we would think about acupuncture treatment frequency and especially herbs. Dosage is a huge part of that. So, but yeah, so we look at the pulse. We'd feel the pulse and see what that is showing us, what organs are, displaying their deficiencies or excesses. We'd look at the tongue, of course. I do a lot of palpation, so if it's colds and flus, I'm gonna be feeling around the neck, I'm gonna be feeling around the face and sinuses. Sinus points up, top with bladder, but upper shoulders. So that's a big one. And then hara, I also always palpate the hara, the abdomen. How are they breathing? Is it tight around the diaphragm? Lung points, and that will give you a lot of information. That's where we get all our information. So
Hmm.
so right away. But if the pulses are showing some deficiency, the tongue is pale, there's cold or a lack of heat, and I just am getting a sense of is this person going to be able to process all the fluid that we might move in a big gua sha treatment, but maybe it still seems a little bit indicated. Just do a little bit of gua sha. Do it lightly. Do it for 30 seconds. See how they do. The other thing is too, like, is this a relatively newer patient, to me? Have I treated them before? Have I seen how they respond to gua sha? So if there's blank spots in our information, then just err on the side of caution. See how they do. Scrape enough, gua sha enough that there's a little bit of flushing, but maybe not the petechia, the actual rash-like expression. And definitely don't go to where it's like bringing up all the purple and kind of deeper sort of toxins coming out.
Hmm.
But then on the other hand, yeah, person is robust and good to go, and they've had gua sha before, and then you could do a stronger dose.
Yeah. You know, uh, again, when I think of releasing the exterior, I mean, I often think of it as an herbalist, and that frequently means using some light herbs, things that go to the surface that float up. Maybe bring some heat up if you need it, but the idea is to try to release the exterior. And it seems to me with gua sha, doing it more lightly would affect that level. Whereas if you get in and start bringing up the purple, correct me if I'm wrong, but I tend to think of that as a more blood level thing and maybe something to be avoided in the case of a cold or a flu, because what you're trying to do, not treat an internal issue, but get rid of something that's at the exterior and it's trying to get in. You don't want it to go in.
That's exactly right. Yeah, that's exactly right. So to err on the side of the lighter gua sha and just let there be some reaction in the skin, which again could just be a little bit of flushing, would generally be adequate. And then adding in the moxa, the warming herbs, the homework, so that people also have that enough chi to be able to, so the body has enough chi to throw off the
Okay.
pathogen.
So let's talk some specifics here. Where
Mhm.
are you guaying? Again, I hear that you're very much a hands-on type practitioner. You touch and feel, and you're looking to see what the body is saying in terms of what it needs. But are there also like specific places you go? Like if there's headaches, do you go to the temples? If there's that feeling of chill, would you go to do 20? Are you doing the bladder line? Are you doing the stomach line? What, again, as a way of helping people think about bringing this into their clinic and starting to use it, especially if they don't have a lot of background, where should they begin? Where should they put their focus? Where do you aim this thing?
Yes to everything that you said, but some of my favorite points are if there is any kind of headache or radiating headache that seems to come from the back of the head, and we know that bladder 10 area, I think that's where we always want to wear the scarf, right? So I love working bladder 10, gallbladder 12 area, like in those window of the sky points. I think it's just a spot where there can be a lot of vulnerability and then a lot of compensatory compression and sort of
Mm.
holding and tension and radiating pain and headaches. So that's definitely a favorite. The back shu points of the lung, upper back. Um, then like kind of gallbladder, like SCM area. That's also just the neck, can be such that vulnerable area. I like to get lung 1 and 2, just
Oh,
like,
those are often
and
so tender.
subclavius area. What's
Yeah,
that?
those are often so tender.
Yes, exactly. They're tender. You'd be amazed. There is often Shaw that can come up in that area. And then if there is cough and phlegm, and I'm starting to think that like stomach channel is involved, I actually
Mm.
like to dredge the lower leg aspect of the stomach channel. And you can palpate and feel like little nodules sometimes. And so I found that that's a nice way also, so we're not just working so much in the upper, but to dredge a little bit. But it has to be a little bit of a phlegm or a little bit of an excess for that to be
So you
helpful.
go down to the stomach channel on the leg
Hmm.
and gua it down there.
Yeah, I've found so much, like when I palpate, there's just so much stuff on that line a lot of times
Yeah.
that can be helpful.
I suspect that might be useful as well for people with something that's more of a flu and they got body aches and they've got nausea. Doing that lower stomach channel might be really helpful.
Yeah, and again, the chances of that presentation actually coming into the clinic, is not that high, but that could be homework. Teach them how to, how to use. I mean, you were telling me when we talked, offline that you give people like the peanut butter jar lid and stuff.
I
Like,
love telling them about the peanut butter jar lid, right? Especially 'cause, look, there's all kinds of fancy Gua Sha tools out there, and then there's the Graston technique, which of course is Gua Sha, and their tools will cost you, a couple $1,000s.
mhm.
I love. Here's the funny thing, right? I originally shied away from Gua Sha because I thought folk medicine. Who cares? But the older I get, the more I appreciate that folk medicine. And the other thing that I appreciate is that, yeah, you take a soup spoon, you take a peanut butter jar lid, and you can help people. You can help yourself, you can help your family. I love putting powerful tools in people's hands and saying, yeah, it's simple, but it's effective. And the very thing that used to shy me away from it is now the thing that I call a benefit about it.
Yeah, I think it's good to have. I like having the tool that I use. We were also talking about, we really like the acuartistry copper tools. So
Oh,
I
those are
like
fabulous.
having they're just amazing. So I like having a tool that's going to last forever and has the good edge and feels good in the hand and is going to, be a workhorse in the clinic. So yeah, ideally a patient would have experienced how I do gua sha so they can get a sense of just what it feels like and the connection of the tool to the body. And then, just yeah, let them know what they can do at home with lids and spoons and
Yeah.
yeah, it's
I
really
I
useful.
like to teach people how to do it like you. I like because I want them to take care of themselves and we'll do it together. I'll have them put their hand on mine and we'll do it. And then I'll have their hand on the tool and help them get the pressure and teach them how to feel the tissue through the tool. Anybody can learn to feel it. It's not difficult because the tool will amplify what's going on with the tissue underneath. People really like that. They can start to feel a sense of capability pretty quickly.
That's great. Yeah, that's it. We have to feel the tool is just an extension of our hand, as a provider, but then certainly for a patient working on themselves.
Hmm.
Just to finish the thought of, because you did mention, do we do gua sha on the face?
Hmm.
I definitely do gua sha on the face, but then it's a different tool or a different technique. So I'm not using the scraping edge. If I'm using the copper tool, I would use the concave smooth end and just then I'm using like a smoothing technique or one of the like gua sha tools that most people think about, like the semi-precious stones with the rounded edge. But working the sinuses, working the stomach channel around here is so helpful
Uh-huh.
for sinus congestion.
Is there any reason not to go, look, people are sick, they're at home, they're not going to be going out anyway. Is there any reason not to go a little bit stronger, bring up a little bit of Sha and help release that for the sinuses?
It would really depend. I would just the having Shaw on the face and the potential of like, just skin, I don't say skin damage, but like, the tiny remote chance of a broken capillary or something. Like I've been cautious about it, not wanting to risk it, and just that I can still get some flushing, some reaction, some movement of fluids without
Hmm.
having to scrape. I that's something I err on the side of cut, but I'll totally go for the neck.
Yeah.
Maybe the lower jaw, but like here by the nose, I don't know. That's just my little hang
Okay.
up, but
All right. Fair enough. What about body aches? For folks that have the flu, they got that chills, and at the same time, they're kind of warm and the body's just super achy. What do you do
hmm
for that?
Again, this would be more theoretical, but because I'm either if their body aches, it would be sort of like on the end of the sickness by the time they come in. But yeah, if you can catch it early, back shoe points are nice, just right along the spine and, get that whole swath and all those organs. Because when it's body aches at that point, that's a lot of different organ involvement. So it's nice to just dredge all of that, I would say.
Hmm. Anything on the lower legs for that as well?
You could do gallbladder, stomach. Yeah, I
Yeah.
think those are, yeah, that would be where, I mean, yeah, you gallbladder for Shaoyang if it is that fever chills, potentially.
Hmm. I love the idea
Yeah.
of doing some gua sha on the lower part of the body to help treat systemically. That just makes a
hmm
world of sense to me.
Yeah, yeah, it's
Yeah.
helpful.
Okay. Now let's talk aftermath for a moment. People that have like lingering coughs, they might be phlegmy, they might be dry. Look, there's all kinds of lingering coughs. How do you deal with a lingering cough after a cold or a flu?
I love working the intercostals. So you definitely gotta, start really light because that's not the most fun place for people, but often with just a small dosage, there'll be a lot of Shaw that comes up because there's just, I think, just that heat, phlegm, tension, if they're like a really a bad cough, just like tension builds up and it really embeds in those kind of intercostals, serratus, just the like lateral rib area
Hmm.
is a really helpful point. There's other stuff I do just from like an acupressure perspective. A lot of times for a chronic dry cough, so this isn't gua sha, I guess, but I will do acupressure on stomach 9 here,
Oh, yeah.
just to like just help like open that up or needle it. And then I'm also thinking scaling. So I just generally I haven't found the technique to scrape on the scalenes directly personally, but if someone else can do that, good, go for it. So I'll usually just get like where they attach, kind of around like rib 1 or 2, like just under the clavicle there. So yeah, I'll find so then and then once I'm there, then I start to find stuff in like the kidney line actually in the anterior intercostals. So I just think of like the physiological impact of coughing if
Hmm.
I'm just thinking gua sha, and then of course the needles for the other um, you know, healing points.
Yeah. That makes so much sense. I mean, when people have coughs, this whole upper part of the body is so affected, right? And things really lock down. And the beautiful thing is you were saying it's a controlled burn. It brings in some heat, it moves things, softens those tissues. So yeah, it's a pretty direct way in with a dang peanut butter jar lid.
Yeah, it's direct. I mean, I think that's what I like about Gua Sha. It's direct. You just go to the problem and sort of create a big change.
Yeah, great. Okay. So I think that's enough to give folks a sense of some of the wonderful things that they can do with this. If they wanted to learn more about what you're doing, where would they go?
You can find me bluefirehealingarts.com. That's my main hub. So there's links there to my private practice, which is just outside of Portland, Maine. There's links to my online Gua Sha class, which is on Net of Knowledge. My other class, I actually also teach hospice and home health acupuncture, one of my other specialties. So I have that up on Net of Knowledge. I've got blog posts about Gua Sha, and then I teach in-person workshops. And
Okay.
and you can email me. I love hearing from people.
Great blog post on Gua Sha so they can go in and dig deeper and learn more from you. Wonderful. Carly, anything else you want to say about Gua Sha before we say goodbye for the moment?
Just, I hope people use it. Find a good tool that you like and think about dosage. It can be just a small amount, and I think you'll really help your patients.
Terrific. All right. Thanks so much for your time today.
Thank you.
When you're looking for herbs, tools, and supplies to guide your patients through life's transitions, you need quality you can trust. Lhasa OMS offers an unmatched selection of acupuncture needles for every style, herbs from all your favorite manufacturers, and everything else you need to run your clinic with confidence. Visit LhasaOMS.com to source the herbs and other supplies featured in this series. Use the code FERTILE15 for 15% off your next purchase at LhasaOMS.com. Some exclusions apply. See website for details. That's it for this episode of Shop Talk. Did you learn something that brought a patient to mind? Don't keep a good thing to yourself. Share it with a friend. They'll be happy that you did. And tune in again for our next episode of Shop Talk.